What's wrong with our medical healthcare system? There must be something wrong with it. We have epidemic rates of dementia, heart disease, diabetes, cancer that we never had 50, 60, 70 years ago. All this happening while we have tremendous advances in medical care, medical advice, new pharmaceutical discoveries. Is that good? Every day, I observe more and more of the reality of what's going on with the health of the average human being, and I question it more and more. I'm sitting out here this morning, drinking my coffee. I was out enjoying a little sunlight, and I came into my outdoor patio where I generally spend the mornings, and I watch TV, watch YouTube. My own experiences in a couple of major hospital stays, one for my head injury and subsequent brain surgery, and recently for my stroke. I'm more afraid of the damage that they'll do to me if I turn myself over to this so-called healthcare system than if I just avoid them, do what I know to do to be as healthy as I can be, proper nutrition being the most important thing, followed up by adequate movement, and I guess just as important as not putting myself into situations where I may get injured or hurt. It's tougher to do when you're young, but at my age, there's very little mountain climbing, car racing, motorcycle riding, or other dangerous things. They're not in my future. So I'm faced with my physical in a couple of days. And I'm supposed to get blood tests. Do I want to even get these blood tests this year? I haven't gotten them yet. My physical is in 2 days. I had planned on getting my blood drawn right before my physical. Not that the results would be there, but I'm saying to myself, why? What am I going to find out? That my cholesterol is high? I know that. I just had my blood tested when I had my stroke. It's the same as it always is. Everything is in a normal range. My cholesterol is screaming high. The medical community panics. They want me to change my life and lifestyle, stop eating meat, stop eating fat, start eating more carbohydrates and healthy whole grains, tons of them, and fruits and vegetables, the very things that caused my health to be deteriorating before I started carnivore, which, by the way, fixed everything. I don't have anything broken. I don't have any pain right now. I'm recovering from my stroke. I don't want to cancel my physical because it never hurts to have somebody listen to your heart and somebody to talk to about little things that might be bothering you. But overall, I don't want any advice, especially from these people who are so misguided. There'll be less risk in avoiding the healthcare system completely than in trying to find out if there may be something that I can do something about. After all, I'm approaching 80 years old. It's a matter of risk. It's a matter of risk. If I'd have listened to urologists 30 years ago, I probably would have had my prostate removed. My prostate is working just fine. If I think about all the times I did not listen to the advice of the medical community, I think I'm better off for it. There are times when I have listened to the advice of the medical community. When I had a big dark spot on my nose and a biopsy showed that it was melanoma, I had the surgery. Yes, yes. I'm not against taking advice if there's some kind of a symptom or an indication that there really is a problem. But why do I feel the need? Why do we all feel the need to find problems, identify problems, health problems, that really, for us, aren't really problems? To start taking drugs, to have procedures that we really don't need. This is a recent development in the human experience, all this medical care. Maybe we were better off with the witch doctors a couple hundred years ago. Maybe the cavemen were actually better off. Sure, they died from infections and gangrene and things like that we can fix today. So the next time you hurt yourself and you break something, sure, go to the medical community, get it fixed. But I'm going to skip my blood test this year. My doctor will complain and tell me how foolish I am. Meanwhile, I think I'm healthier than most of the people in the medical and healthcare community. Just look around. Watch that thing on, if you have Amazon Prime on TV, watch that show. Watch that show and tell me if you think with all that healthcare, after looking at all the healthcare professionals and the doctors and nurses in that series, that they're really on the right track. I don't think so. I'll go for the physical. I'll give you a report about what happened and tell you the lectures that I got. But I do not want to have another person tell me that I need to be on a statin because my cholesterol is killing me. It's been high all my life. I haven't had heart problems or a heart attack yet. I have no symptoms of heart disease. I have no ED. I have no chest pains. Yeah, there's a 1 in a million chance that I'll have one of these silent heart attacks. So be it. So be it. I'm almost 80 years old. There comes a time in life. There comes a time in life when we get to a certain age where we have to stop trying to live forever and focus on the basics, if we're healthy, that got us to 80 years old without all the drugs and supplements and miracles, and just be happy. Eat right, move, get some exercise, give up the goal of being the next Mr. America, and just enjoy life. Enjoy what we have. Make the best of what we have left without looking constantly for more and more things to agonize over and worry about. I renamed my channel Healthy Aging. And I think one of the most important points to age in a calm and healthy manner is to not continually look for some other obscure thing that you think you need to fix and agonize over it. And if anybody doesn't think that knowing that you have a condition or what somebody tells you is a condition that could be instantly catastrophic, you will spend the rest of your life every minute, waiting for that event to happen. And you won't be living life anymore. You will not be enjoying your life. That's about the best advice I can give. Whether it's right for you or you take it or not, that's up to you. Whether I'm completely wrong about that. Whether we should live our lives wired up to machines and monitors and constantly know our ketone levels and everything. Some people seem to enjoy that. Not me. That just makes me worry. Take it easy. Take the rest of the day off and eat meat.